Merkel cell carcinoma is a disease for which there are no FDA-approved therapies, and because chemotherapy can often have the ability to shrink the cancer, but does not produce lasting benefit for more than a couple % of patients, the status of where we were for treating Merkel cell carcinoma was extremely unsatisfactory. Moreover, it was really clear that there were especially strong links between Merkel cell carcinoma and the immune system. So for a lot of reasons that I could go into, we felt there was strong rationale for looking at immune therapy in this cancer. So Merkel cell carcinoma, while it's a rare cancer, if a person has it, they actually have a 3 times higher chance of dying from it than a melanoma, which is often called the most lethal type of skin cancer. So it is a very serious type of skin cancer, and we can treat it early with surgery and radiation very effectively, but 40% or more of patients with a Merkel cell carcinoma will recur in the area or elsewhere. So there was a great need to deal with those patients who have developed distant disease. And for many years, I, for one, just hung my head low and said, I'm sorry, there's really nothing that we can do. We can shrink your tumor temporarily with chemotherapy, but there's nothing that we can do. So against that backdrop, it was very exciting to explore immune therapy. It's early days still in terms of comparing pembrolizumab to chemotherapy, and moreover, this was not a randomized trial. So our comparisons to chemotherapy are based on historical controls. However, no one in the field is arguing that chemotherapy benefits are short-lived. That's quite well established and clear. And half of patients progress on chemotherapy by 3 months, and that number goes down to 6% only at 10 months, to 10 to 12 months that have not progressed on chemotherapy. So the fact that now it is pretty clear that pembrolizumab has the same basic response rate, which is a bit over 50% in putting people into a good response as chemotherapy, is nice, but the real benefit is that of those responders, 86% are remaining in response over time. And I'm sure, and we know, some people are failing over time, but it's a much lower fraction than fail from chemotherapy. And chemotherapy is immune suppressive and selects for tumor variants that are more aggressive. So once it comes back after chemotherapy, it's a real challenge. Moreover, the pembrolizumab is better tolerated in terms of quality of life, for the most part, than chemotherapy. The high-level summary of results was that by RECIST criteria for solid tumor shrinkage, 56% of patients had objective responses, meaning they were confirmed by a subsequent scan. And again, 86% of those responders are remaining in response at a median time right now of 7.5 months after starting drug. So that compares very favorably to chemotherapy. I think an important point is that while 80% of Merkel cell carcinomas are caused by a virus, there's a fraction that are not caused by a virus, and those actually tend to do a bit worse. They are more aggressive than the virus-induced Merkel cell carcinomas. And we saw responses among both the virus positives and the virus negatives. So it suggests that this therapy could be of use for any subset of Merkel cell carcinoma patients. I think the take-home message is that immune therapy makes sense in a variety of cancers, and it makes particularly strong sense in a cancer like Merkel cell carcinoma that is so strongly linked to immune function in terms of whether a patient gets it and whether a patient survives. That data is well established out there. And now to have a drug that can release this brake, de-exhaust the T cells, whatever phrase you want to use, really show benefit is exciting. And I think that in most cases, the concept of treating first line with chemotherapy is not going to be the way most people are thinking it makes sense to manage this cancer. Chemotherapy still has a role for sure, but it won't be the knee-jerk reaction that everybody needs chemotherapy for advanced Merkel cell carcinoma. So I think the main take-home is that immune therapy is going to be the backbone of therapy onto which we're going to add radiation, perhaps some chemotherapy, other immune therapies. But it's an exciting day for a cancer that really had no specific therapies available. And now there's clear science and clinical data to suggest that immune therapy is going to be beneficial.